Willkommen an der Universitätsklinik für
Welcome to the Department of Radiation Oncology. As head of the department, I would like to welcome you. In the following, we will give you an insight into the procedures at our clinic. What can you expect during your treatment? Radiation oncology uses different types of radiation, often in combination with other cancer therapies, such as surgery or drug therapies. This is why we are also part of our hospital's comprehensive cancer center. Around half of all cancer treatments include radiotherapy. Through scientific research and the development of modern technologies, including artificial intelligence, we are constantly developing and improving the therapy. Radiation is invisible, you can't feel it. It penetrates the body in a targeted manner where it can destroy cancer cells. Radiation oncology works as a team consisting of doctors, medical physicists and technologists, radiology technicians, nursing staff, clinical psychologists, and administration. We are all there for you every day to provide the best possible therapy. Take a look. The Department of Radiation Oncology is located at level 3 of the AKH. Your first contact is Leitstelle 3B. Your personal data will be registered here. Please bring all disease-related medical documentation and images with you to your initial consultation. You can take a seat in the waiting area and wait for your personal consultation with your radiation oncologist. In the initial consultation, we discuss all your complaints and findings, as well as previous treatments. We will then discuss with you in detail about your individual treatment options, the sequence of examinations that are necessary for planning your therapy, your treatment itself, the aim of your therapy, and possible side effects. We will take the time to answer your questions. You are welcome to bring a trusted person to accompany you. During the intake consultation, you will be given all further appointments for your preparatory procedures and the start date of your treatment. For each radiotherapy treatment, i.e. for each individual patient, a so-called radiation treatment plan is made and tailored to your individual situation. For this treatment plan, you typically undergo a planning CT scan and sometimes also a planning MR scan. We will take a portrait photo of you at this appointment. This improves patient security to prevent any confusions. For every radiotherapy, positioning that is accurate to the millimeter level and easily repeatable plays a major role. We will therefore set you up precisely, but also in such a way that the position is as comfortable as possible for you during the treatment. We use various aids for this purpose. For breast cancer patients, these are mainly arm supports. We have a special support for the legs when radiating the prostate. If you are being irradiated in the head and neck area, a mask will be made. This consists of thermoplastic material which is molded in a hot water bath to fit your head and shoulder area. After a short time cooling down, your position is fixed and can be reproduced efficiently and precisely at every treatment session. To ensure that the position setup can be reproduced quickly and precisely during treatment, lines are drawn on your skin with felt-tip pens, which should not be washed off. We also use positioning lasers or a surface scanner and document everything with photos. We are present at all times during the examinations and ensure that everything is carried out with highest precision. Our radiology technicians can see and hear you at all times.
Bitte einatmen und die Luft anhalten.
After your examinations, you go home and we start planning your treatment. Your doctor will determine the number of radiotherapy sessions and the exact dose for the treatment. Radiotherapy usually consists of several sessions, also known as fractions, each lasting no more than a few minutes. We create your individual treatment plan based on your images and findings. The region to be irradiated is determined, as well as any areas that we particularly want to protect from the radiation. More and more artificial intelligence methods are being implemented into daily clinical practice, for example, to further improve organ segmentation and dose distribution. The high quality of our radiation plans is ensured by strict processes and is continuously and comprehensively monitored. Each individual treatment plan is checked several times and verified by measurements taken by medical physicists. Once the plan has been approved, we forward it to the radiation machine, the linear accelerator. The linear accelerator, LINAC for short, is the typical device used for modern radiotherapy. Our devices are latest technology, and you can always be sure that the planned dose distribution of the radiation reaches the tumor region with the planned accuracy. You register at Leitstelle 2V, the control center for the treatment area, on each of your treatment days. We will know you personally very quickly. The radiation appointments are precisely scheduled, and you only have to wait a few minutes. When we call you, you go into the cabin and get ready for your treatment. As you enter the treatment room, we will call up your personal treatment plan. We will check your identity with your name and date of birth and compare you with your photo. For precise irradiation, it is important that you take up the exact position on the irradiation table. Our radiology technicians will position you and recheck it again. In some cases, it is important that you hold your breath for a few seconds. In special cases, this measure contributes to even gentler radiotherapy. If all the checks are correct, the radiotherapy can begin.
Genauso liegen bleiben, nicht bewegen.
During irradiation, the large irradiation head, called gantry, can rotate around you. However, it will never touch you. The radiation itself is a completely painless treatment that only takes a few minutes. The radiology technicians in the control room can hear and see you at all times. You can talk to each other at any time during the treatment via an intercom system. Even if you have questions or complaints at some point during your treatment, the radiology technicians are your first point of contact. They will also organize appointments with your doctor. At the end of your treatment, you will have a final consultation with your doctor. They will discuss exactly what will happen after the therapy. Will you receive further treatment such as medication? What will your aftercare and follow-up examinations look like? This is different for every patient. Brachytherapy can be an important part of the treatment for some tumors, especially for gynecological tumors. Brachytherapy is radiation from the inside. Under anesthesia, a so-called applicator is brought directly to the tumor. The applicator has channels for thin tubes into which mobile radiation sources are inserted during radiotherapy. A second form of brachytherapy is the introduction of several radioactive radiation sources, so-called seeds, a few millimeters in size, directly into the tumor. This also takes place under anesthesia. These seeds remain in the tumor and irradiate it for several months while their activity decreases. With brachytherapy, the tumor can be irradiated from a very short distance in a targeted and gentle manner with very high doses. During radiotherapy, we will support you regularly in our outpatient care clinic. This enables us to catch any complaints or side effects during treatment at an early stage and provide targeted treatment and care. Qualified nursing staff who specialize in radiotherapy side effects are there for you. The nursing team will also provide you with special support if you have any problems with your diet. The nursing team on our ward cares for patients who are admitted as inpatients during or after radiotherapy. Supportive therapies of all kinds are offered here, or accompanying drug therapies such as chemotherapy are administered. Cancer and cancer treatment is a challenging situation for many people and their relatives. Questions about personal, family, and professional situations often need to be discussed. We offer you the possibility of uncomplicated psycho-oncological counseling free of charge with the aim of maintaining or regaining a good quality of life. The entire radiation oncology team will accompany you on your journey through radiotherapy and is always readily available to answer your questions. In the first instance, please contact the control centers or the radiology technicians during radiotherapy, who will always be there to help you. We hope we've been able to give you a good insight into the processes at our department with this video. If you have any questions, please contact my team or me.